But some of the frontline workers who have felt the wrath of the pandemic. Pharmacists say although it hasn't been easy working in the frontline during the pandemic, they are ready and bracing themselves for anything. Newzroom Afrika's Newzroom Afrika spoke to one of them and filed this report.
The grip has been felt and there seems to be no end in sight. Since the start of the pandemic, the aisles have been more frequented, at times by panic-stricken South Africans, many of whom wanted to self-medicate. These pharmacists have seen the highs and lows of it all since the first wave.
The pharmacy was packed. There's some of the staff here that only work like half day or until 2 o'clock or 3 o'clock. We were all working full day then. There was no opportunity to take a lunch break. You were just almost working on autopilot. At the end of the day, we were exhausted, and the biggest worry for us was that we were making mistakes because you're put under so much pressure. The phones were ringing, the people were standing in front of you. We had to close the doors at one stage and limit the number of people coming into the pharmacy.
South African scientists announced the discovery of a new variant in mid-December, which is said to have fueled the surge in infections. None of these pharmacists could have anticipated the second wave of traffic, as December and January saw another uptick in patients.
We've noticed it's not from people coming into the pharmacy, but mostly from people phoning and sending scripts through and then organizing deliveries and queries. And then plus every time there's a new medication that's been advertised on social media, then people are phoning to find out, do we have, where can they get? So you're spending a lot of your time answering those queries and trying to get the medication out and the orders out as soon as possible. So we were also pretty tired and exhausted this December and January. And then of course you're going home and you're going home to your family. All these sick people that have been in the pharmacy, you're always in the back of your mind, you're thinking, are you taking this thing home with you?
May's Chemist is one of the corner pharmacies who managed to keep their heads above the sprawling waters of COVID-19. Although rocky at the beginning, big pharmaceutical companies were able to respond quickly to the growing need for testing facilities, while smaller pharmacies like May's Chemist were unable to obtain them due to lack of capacity. But in small leaps and bounds, they were able to break through.
Now there are new rapid tests that have come on the market, so they're a bit more easier. They're faster. You usually get the result within 15 minutes. So we are going to start doing that at the moment. We've also started doing the antibody testing, so that will check if you have been exposed to COVID in the last 2 or 3 months.
The COVID-19 vaccine jab is expected to boost healthcare workers' fight against the pandemic, and May's Chemist is also hoping to join efforts in administering the jab. They're currently registered for a training program with the National Department of Health.
There are different vaccinations that are available, so storage is going to be an issue, especially those that need to be kept in a frozen environment. I think that will pose a problem. But that will be further down the line because the vaccines that they're getting now are the ones that can be stored at regular fridge temperature. It's a bit more suitable for the South African environment. But yes, as soon as the vaccines become available, we will be ready and able to give them.
The next phase of the pandemic, which is the rollout of the vaccine, will certainly be a challenge. But pharmacists here believe government should prioritize strengthening the front line, which in turn will boost public confidence. For Newzroom Afrika on Channel 405, I'm Newzroom Afrika in Johannesburg.